Hello viewers, this is Dr. Isatu Kakay-Diallo coming to you today with a brand new topic about early detection, cancer screening and prevention. As we talk about these different things before we even start talking about the different cancer types, when to prevent yourself from cancer or when to screen for cancer, let's first define what cancer is. Cancer is a disease in which some of the body's cells grow rapidly and spread to other parts of the body. It can start almost anywhere in the human body, and human cells grow and multiply on a normal basis. But for cancer cells, it grows rapidly, and that's the difference between cancer cells and normal growing cells. And then why do we think that early detection can help someone? Well, according to the World Health Organization, early detection will focus on detecting symptomatic patients or individuals as early as possible for the best chance for successful treatment. When cancer care is delayed or inaccessible, there is a lower chance of survival, greater problems associated with treatment, and higher cost of care. Early diagnosis will improve cancer outcomes by providing care at the earliest possible stage. So when they said earliest possible stage, what are you worrying about? You're worrying about a metastatic disease. So if we are able to detect a cancer at a very early stage, let's say a stage 1, stage 2, the curative intent is greater for that person, and the cost of treatment also is decreased. So that's why early detection is significantly important in cancer care and prevention. And then screening. What is screening to start with? Screening definitely is like a presumptive identification of unrecognized disease in apparently somebody who's healthy. They have no symptoms, by population means of testing. You could do this either by physical examination, other procedures that can be applied rapidly, easily to target a specific population or individual. It is a program that is used to ensure that these individuals can access effective treatment if diagnosed with a disease. Let's say, for example, breast cancer. If somebody is doing a breast self-examination and they find a lump, a mass in their breast, they are actually checking. And also if they go into their primary care doctor and they are being screened, annually, their chances of finding out about cancer is greater at an early stage compared to somebody who's not going to see their primary care doctor or who's not even checking their breast. Like for women, the 5th day of your menstrual cycle, you should be doing a breast self-examination, meaning you feel your breast, whether you are standing in front of a mirror, whether you are lying on the bed, with your arm raised up, you make sure that you check under the armpits, or whether if you are in a shower. The reason why they said the 5th day, think about it. When you're about to go into your menstrual cycle, your breast is going to be engorged. So, right in the middle of the 5th day, there's better chance that, if there's any masses, you won't feel like it's engorged. It's more softer, for you to be able to detect any abnormal findings, in the breast tissue. So that's why it's recommended to do that. So this is for all women, and also screening actually would start at, which is with mammography at age 40, unless this person have a family history of breast cancer. The screening will start sooner than the age 40. And then based on the WHO statistics, about 9.6 million people worldwide are estimated to have died from cancer in 2018. About 30 to 50% of cancers could be prevented. That's a great number if we can screen patients frequently, or people can be screened early during physical examination, annual physical examination, or we can look out for these, do preventative, healthcare, community sensitization about early detection, on cancer patients. And if the patient has a higher risk or family history, puts them at higher risk compared to that person who do not have a family history of cancer. And some genetic factors put your risk higher compared to somebody who has no genetic mutation or factors, like a BRCA mutation 1 and 2. The person is at higher risk for different types of cancer. But today we're going to focus on detection, screening, and prevention. And our next segment will then focus on individual cancer types and what are those types of cancers and what to look out for and what to do, what are some of the treatments and preventions. And then you talk about, a different statistics worldwide. Cancer is among the leading causes of death worldwide. In 2018, there were 18.1 million new cases and 9.5 million cancer-related deaths worldwide, same as or close as what WHO has, and this correlate together. By 2040, the number of new cases per year is expected to rise up to 29.5 million, and the number of cancer-related deaths up to would be 16.4 million. That's a huge increase. So early detection saves lives. Generally, cancer rates are higher in countries whose population have the highest life expectancy, educational level, and standard of living. But for some cancer types, such as cervical cancer, the reverse is true, and the incidence rate is highest in countries in which the population rank low on measures. So cervical cancer, because probably people in a low socioeconomic status or countries that are developing don't screen more frequently, for cervical cancer compared to other type of cancer. So that alone calls for a concern. Then age. What age should you really screen for cancer? For breast cancer, age 40. You can do this by mammography, along with early breast self-examination, which should be done monthly. So for patients that are not, or people that are not seeing their menses anymore, they are on menopause, should pick a specific day within the month to make sure that they check in their breast monthly, and also making sure that they make their annual visits for mammography. Some mammograms might require not just the X-ray, but also an ultrasound because the patient have a dense breast. The other cancer type that needs screening would be colorectal cancer, right? Colon and rectal cancer, where you have to do a colonoscopy. At regular screening, they want it to be at 45. Before now, it was 50, but the new guidelines says at 45 years old, people who are in good health and the life expectancy is more than 10 years should continue regular colorectal cancer screening through age 75, unless the patient has symptoms. They present with GI symptoms, bleeding, weight loss, different GI symptoms may warrant, early colon cancer screening, or even at a later time. Then the prostate. At the age of 40, this is for men. Age 40, they do a blood test, which is a PSA, or prostate specific antigen. And with that number, it would indicate whether this person is having a higher number or lower number that warrants a biopsy. Again, we will talk about all these different cancers, one topic at a time. Today, we're just giving an overview of the different type of cancers out there that requires early screening for prevention and early treatment if needed. Cervical cancer, women cancer, right? Age 25 is the new recommendation. So people that see their GYN doctor or gynecologist will be doing a pap smear along with a HPV, which is like co-testing, right? To check for human papilloma virus. They do that every 5 years. The guidelines has changed. Before, people have to do pap smear every year. Now you can do it every 3 years, if it's just the cytology. But if you're doing it co-testing, it's like every 5 years. Unless something is wrong, then they'll require you to repeat the test. And then the good news, there's a vaccine available for patients or for people age 9 up to 45. But mainly we try to encourage teenagers, young ones, to get 2 doses of this vaccine. It prevents against 4 different types of human papilloma virus. That's type 6, 11, and 16 and 18. So 6, 11, 16, and 18. These 4 types are being prevented by the Hpv vaccine, which is Gardasil. So they'll get 2 doses 6 months apart. And then for people that smoke, how do you prevent cancer? Stop smoking. Quit. Nobody's saying to quit like cold turkey. If you know that you smoke a pack, cut down. Every day, cut down. And then with time, you get used to it. And then you eventually quit. Stay away from people that smoke. If they are the one that making you smoke, stay away from them, right? And then in people that have smoked for many years, there's guidelines that they could do a CAT scan, which is a low dose CT scan, to find out if there's any lung nodules, so that they can cut lung cancer at an early stage, and then the survival rate will be greater compared to somebody who find out based on symptoms. And then for cervical cancer screening, again, because it's very significant, according to the American Cancer Society, it recommends that individual with a cervix intact, cervical cancer screening should be at the age of 25 and undergo primary HPV testing every 5 years, which I just mentioned, through the age of 65. And then that is preferred. If primary HPV testing is not available, then individual age 25 to 65 should be screened with a co-testing. That means HPV along with cytology every 5 years, or cytology alone at every 3 years is also acceptable, and it's strongly recommended. Since 2010, the American Cancer Society and other organizations have recommended that cervical cancer screening should begin at the age of 21 and no earlier than that, regardless of the age of first vaginal intercourse. They don't want you to do a cervical cancer screening earlier than 21. But now the new guidelines, 25 years old. We'll see what the statistics say about that. And now, this is the age that we're going to focus on. Why? Because, with the fact that when you screen these patients under the age of 21, less than 1% were detected to have cervical cancer. And people that are at around the age of 25 to 65 have higher percentage, meaning from 4% up to 9%, and even 11 and 12%, which is around the 40 to 49 year mark, up to 59. So you would see the reason why you have to screen above 25 or 25 and above. So again, as we mentioned, the HPV vaccine, which is Gardasil 9, you can give 2 doses, 0 month and 6 to 12 months. So if you get for the patients that are, or the individuals that are 9 to 14 should get the HPV vaccine, 2 doses. If they get it today, they wait they could get the second dose 6 to 12 months. For 15 years and 26, before that was up to 9 to 26 years, but recently they extended it up to 45 years. And this is not just for girls, it's also for boys. I have 2 children in this age that they can get the vaccine. They are both vaccinated. My daughter and my son, they are all vaccinated already, both doses done with that. So she's 13, and then I have an 11-year-old. They already completed their 2 doses. And if, for those that get in the vaccine after the age of 14, will now need to get 3 doses. So it will be good if you have children for them to get the vaccine early, from 9 to 14, so they will only get 2 doses compared to if they have to get it after, right? So if they get in 3 doses, it will be 0 months, 1 to 2 months later, and then 6 months. And then for people that are 21 up to 26 years old, for male patients, they would be offered 3 doses regimen, which is the same as the 15 to 26 years old. For 27 and older, up to 45, the FDA had now approved, Gardasil vaccine, but not routinely. So if people want to get it, they can get it as long as, they feel like it's going to protect them. So it makes sense for you to do that. And then the other thing here is age for screening breast cancer, or cancer prevention, or you want to know what's your risk for cancer. We said 40 years to 49 years old if you have risk. So the United States Preventative Services Task Force, the decision to start screening with mammography for them, saying, prior to age 50 should be an individual one, right? That's what they recommend. Compared to American Cancer Society is saying women age 40 to 44 years old should have the choice to start breast cancer screening once a year with mammography if they wish to do so. Then you go to the American College of Obstetricians and Gynecologists. For them, after counseling, and if an individual desires screening, mammography may be offered once a year, right? Or once every 2 years. So all these different organizations have their own preference. And then the International Agency for Research on Cancer, there is a limited evidence that screening with mammography reduces breast cancer mortality in women 40 to 49 years old. Then American College of Radiology, screening with mammography is recommended once a year between the age of 40 to 49. Then you have the American College of Physicians, which they thinking screening breast cancer with mammography before 50 years old, should be discussed with the patient. So they all have their own guidelines and recommendation. And then if they are at the age of 50 to 74, I believe, the screening should be 1 to 2 years for the U.S. Preventative Task Force. And then you have the American Cancer Society, 50, should be at least annually, and then and so forth. So, but you discuss this with your primary doctor, and then they will guide you accordingly. So after the age of 75, then the question is, there's not enough evidence. And for the American Obstetrician or College of the Obstetrician and Gynecologists, for them, there should be a discussion whether you want to stop at the age of 75 or older. So that depends, right? So this is screening we are talking about. We are not talking about people that have cancer. We are talking about those that need screening. They have no risk that is high, putting them at higher risk for cancer, like family history and things like that. So that's a difference. But these are just recommendations by different, organizations, colleges, and that things, screening should happen at a specific intervals. Then for the prostate screening guidelines, which is from the NCCN guidelines, right? So they deal with all the different, this is like a National Comprehensive Cancer Network, different physicians coming with different ideas, and based on clinical research, men at least 40 years old, if they don't have no risk, no family history, African American, a PSA, above 1.0 micrograms per milliliters, and also they take in medications for like a benign prostate hypertrophy. If it's negative, they may have to do a digital rectal examination. They may have to repeat the testing every year. So if the PSA is above 2.6 micrograms per milliliter, or the digital rectal examination is positive at any exam, they want to obtain a biopsy. Remember, the blood test is there to screen. Now, the moment they find out that the number is above 2.6, the patient will require a biopsy, which they have to put in a needle to take a specimen, different parts. They'll divide the prostate screening into like 12 different locations. So the needle will have to be able to hit that. So based on the findings, you will know whether this patient have a prostate cancer with a Gleason score. So again, we'll discuss that on a specific topic that is dedicated for prostate cancer. Other than that, patient will continue to repeat, PSA level, which is a blood test every year. Then we talk about cancer. Why do you need to screen early? Why you want to detect early? If you don't, and you don't present with symptoms, you show up one day in a hospital with a cancer diagnosis that is actually a stage 4. Stage 4 is like really, there is no cure, but they will provide you with, treatment to improve the quality of your life and extend the duration of the patient's or the person's life. And in order, so that, because at that point, the cancer is not only in the breast or the lung or the liver or the bone, the cancer has traveled to a different part of the body. So for you to have a stage below 4, your rate of cure is greater. And that's when we say curative intent, right? But when you have a cancer above stage 3, now you're at stage 4, all you can do is try to manage and control the person's symptom. The chances of cure is really, there's none. right? So that's why screening patients, detecting things early would definitely help in how, to manage and treat cancer patient. And then the other thing here, let's take a look at the liver. We've discussed the liver before. Look at the healthy liver and look at the chronic hepatitis as well as cirrhosis and hepatic hepatocellular cancer. So these different types of cancer and staging could be concerning. So just take a look at how the liver looks, when you have cancer as well as when you have inflammation. And then metastatic cancer has left the original site and now you can find it in a different part of the body at a different organ. Meaning, let's say if it started in the colon or in the stomach, now you have it in the lung, that's considered metastatic. And also you may have it in your lymph nodes. Your lymph nodes now, it has infected the lymphatic system, as well as other part of the body. Sometimes patients get the cancer up to, brain metastatic cancer. It's scary. It's really scary. So screening, early detection, again, is very important. What is the take-home message from all of this? You can help reduce your risk of cancer by making healthy choices like eating right, staying active, and do not smoke. It is also important to follow recommendations, screening guidelines, which can help detect certain cancers early. And this is according to the American Cancer Society. So that's the take-home message, and that's the statement I would also encourage you to do. Make sure you get screened early. Make sure you talk to your primary care provider. If your family history is high, puts you at higher risk. Your family history puts you at higher risk. If you have a parent or a grandparent or a sister with cancer, your risk is higher compared to somebody who has no family history. So for that, we'll end the topic here today from the English language. I will now speak briefly on cancer care in Creole. Hello, Miss Salon Famuden. This is now Dr. Isatu Kakay-Diallo. Today, I bring you a new topic where they talk about, cancer detection, cancer screening, and prevention. With this, first things first. If you get family history, you get posse, you get mama, you get sister, you get granny or grandpa, we get cancer, not their body, or we they don't treat because of cancer. You don't risk a higher past that person will not get family history. Will not get nobody in a family with any form of cancer. Waiting at cancer. Cancer is something we body normally we dey grow cells them. Meaning, part of the body, even this with skin where they see so it grow cells them. But it get rid of the one then we don't want. We body can make cells. What you not want, it get rid of her. It stay in your body. But what you need for stay, it stay. But we get cancer, it just stay steady. It need to move. Then it continue for cause blockage. Just they add up. Just take and like say you don't go bail sansan, for example. You don't put on her. It need move. Just stay steady until rain come. It take them out of there. And they go. So the cancer, the cells then just go they add up, then they build up. Then if you see, they begin to see the tissue then not normal. You see say, the person don't begin get growth of something where they're not supposed to get. So if your skin need for be smooth like this, then you begin to see something where they swell up normal, they swell. They even move. So that's the person, not the heart. Right? So if you need the heart, you definitely not call for concern. Get checked, let them check you. But for the woman then, which I really want for talk, because cancer now the leading cause of death worldwide, right? According to the World Health Organization in 2018, then we get 18.1 million new case them, and also 9.5 people that will die now because of cancer worldwide, right? And then they estimate say up to 29.5 million, and also about 16.4 million will die because of cancer. And then a huge number. So what we for do? We for make sure say we get we self screen, like you and a woman every month. You for check your breast, especially by period, that monthly cycle. The 5th day of the monthly cycle, make sure say they check your breast. Either way, it's map in front of the mirror, or way they take shower, or way they don't have bed, you put your arm up. If you don't sabi this, just type in na YouTube or na Google, it will show you how to do breast exam on yourself. If you feel anything, tell your doctor. Now, so you don't also take and say it get better, and it get better. If they not do mammography, they're not going to know what's in the go on when I like X-ray of the breast. Sometimes they can do ultrasound back. So you where they check your breast, and also you go there and go check you know, now hospital, now the best thing. Sometimes then your doctor now for they find out. But how your doctor will find out? You need for you go see your doctor at least 1 time per year. So if you don't turn 40 for the do mammogram every year, 40 every year for do mammogram. Me, I don't do mammogram 3 times. Not because I don't reach the age, now because my doctor say if something. The first time when this happened, I've been just like maybe 32, you know. Oh my God, I cry like say they don't diagnose me with cancer. I just tell you. After that, I don't do again 2 times. But after this year, I will begin to do mammogram every year. But I dey check, right? I dey check in the middle of my cycle. But if you're not person way done with you, period, you need to see period again, you don't go into menopause. Spend 1 day inside the month. Let you make a dedicated day inside the month for the check your breast. If you find anything there, when a lump, when a bump, you're not supposed for the day, you're not normal. You begin to get stuff, then blood, they come on a nipple, you know, discharge them. We're not supposed for the day. Under your armpit, you see, you feel lump then they. No sit down also, yeah, no sit down there. Now for go, let them check your breast. Because October, when they cancel, now cancer screening for breast cancer patients them, right? So now the awareness will the raise. So as we hit that month day, this video will be more worthwhile for all talk about breast cancer screening. Then the other thing we need for screen for colon, your stomach. People then can get cancer inside their stomach. So from the age of 45, before now 50, from the age of 45, then for go now the back, like where you know the back of you, where you go toilet, they put camera behind, then check inside the stomach for make sure see they not find no lump, you know, we not supposed for the day. Because sometimes the people then get cancer, they don't know, or they don't find this lump where they call polyp or polyp. Then can you cut them, make sure say it not grow and cause obstruction. Obstruction meaning it not cause blockage, meaning something where for like let's say we turn water like a pipe. Think of a pipe. We turn water, the water need for go, it for flow very well, right? But then if you block because of something don't go block, a lot just say you go put stone there. You know, so a lot of can say the cancer now and I the stone. They, you know, wait, you go to cause you one, you constipated. You need to go to toilet. Your belly dry. You know, you begin to see blood. You know, when you go to toilet, you see blood. Right? So then and they all are sign. If you see that they happen to you, now sit down and go to hospital. Because the cancer it become stage 4, then they will cure them. It will begin left the stomach, they go now other parts of the body, maybe even now your lung, sometimes now your brain, or now your liver. That can happen. For people that work in weight problem happen to them and just the weight. You go get better. Let's just take this medication, this paracetamol, fligene, all the different medication them treat themselves now host pepper doctor. Waiting make they get blood na your stool, normal. So because of that, you need for go check yourself, and then one lady check yourself from age 45 and up to 75. If the person get for live longer, then one lady do up to 75, right? The other thing for the man, then they do blood test, because as then they get older, the prostate, you see how woman and they get breast cancer, man themselves can get breast cancer, but it's just that the percentage is small. But the prostate now, it become bigger as they get older, old men, old age, right? So because of that, then they do blood test. We turn 40 for see what at the number. If the number is above 2.6, micrograms per milliliter, then one lady person do a biopsy, meaning then they put needle at the prostate. The prostate is behind the bladder. Also, they urinate and behind the. So if it's a big number, what if you say going to happen? It's going to make you feel like say you want to go na bathroom all the time. But when you go down, you still feel they say you need for go, right? So then they check now for make sure it's not to cancer, and they need for check early, because if they not check early, if not cancer, it can spread. It is spread to you bone them, and that ending now that they call it stage 4. They will need chemotherapy, sometimes, and some people then surgery. Some people then will do surgery where it don't spread, right? And they will need radiation. The other thing, cervical cancer. The different organizations then want this now woman cancer, for check for cervical cancer with pap smear and the HPV testing, where then they do every 5 years. If not just the pap smear, now every 3 years, but the two then they do it every 5 years. And they get vaccine now for person them when age 9 to 45. So if you get picking them, try for give them before they turn 15, so then we'll get 2 doses. After 15 up to 26, now 3 doses then they take. And you all day, if you want to take them because you feel like they will protect you, get family history, you can get them up to 45 years, or if you're not on 45, the FDA don't approve that. They also say recommended, but if you want to, you can take them. And then if you're not possible to smoke, cut for smoke, not smoke, because smoking then it increase your chance for cancer and all that stuff down. Because the other thing what I can recommend for do CAT scan, like X-ray, a different type of X-ray of your lung, for see, because if you don't smoke over time, your risk for cancer is high, right? So then kind of thing and they recommend. Definitely, they recommend the vaccine for cervical cancer screening. And the reason why they say 25 years of age, because they can say people that are under the 25 years age, in the rate not that much now, like 1%. So but anybody above 25 now up to like 49, 59 to 65, the rate higher can go up to 12%, right? So Lord take them very seriously, because if we not take care of ourselves, we not go there for take care of the family then, right? So definitely cancer, stage 4 cancer, you're not going to do much. All you will do is for try for control the person's symptoms, and they call metastatic, meaning you don't left one place, you don't go to the other side. So the cancer within at the lung, now it in at the brain, or the cancer within at the stomach, now it in at the lung, right? So that in stage 4. So with that, the take-home message from the American Cancer Society, you can able for control your risk for cancer, for make sure say they eat well, make sure say they exercise, make sure say if you're not possible to smoke, you stop for smoke, you stop for drink alcohol, and also you follow the different guidelines and what your doctor will don't tell you. If you find something, you go tell your doctor so that they will do more. So until we meet again, this is not Dr. Isatu Kakay-Diallo. I want for left and also today, and for say to you, what you don't learn today, now for go share, not left hand to you yourself. Make sure say somebody else know. So now remember, let you share, let you like, let you subscribe to the channel and the notification bell. With that, we will bring health topic to now every Monday or every other Monday for make they really know a little bit about we health and how we protect ourselves. With that, I switch now the language, now the English language. Viewers, we'll end today's topic. Until we meet again, this is Dr. Isatu Kakay-Diallo. I just want to remind you to remember to like, subscribe, share, and hit the notification bell, and then we will find a time to discuss each of these different cancer, their symptoms, their type of treatment that is out there, for each of them. But I think just knowing the age of screening, breast cancer 40 years of age, cervical cancer at 25, prostate at 40, and also colorectal cancer or colon cancer at 45 years of age. For that reason, I want to say many thanks to you for listening, and I hope you remember to share this information with other people, and then don't forget to comment and recommend whatever topic you want us to discuss. Thank you very much.